Hello participants. Myself Dr. Adnan Ayan. Van University, Faculty of Veterinary Medicine, Department of Genetics, Van Turkiye. My presentation topics, microscopic and molecular investigation of the prevalence of Cryptosporidium spp in cows in our region, Turkey. Cryptosporidium spp are common intestinal protozoan parasites that cause diarrhea, infecting a wide range of hosts, including humans, domestic animals, and wild vertebrates. Cryptosporidiosis is seen as a zoonotic threat to humans. One of the most common enteric parasites worldwide, Cryptosporidium spp, is a zoonotic protozoan belonging to the phylum Apicomplexa. Cryptosporidium has a ubiquitous geographic distribution and can cause acute or chronic diarrhea and even death in humans and animals alike. Cryptosporidium is a zoonotic coccidian protozoan that causes infections called cryptosporidiosis with diarrhea and other clinical symptoms in humans, domestic, and wild animals. Cryptosporidium spp are worldwide distributed and represent the most frequent pathogenic agent identified in cows. Cryptosporidium parasites have a monogenic life cycle with asexual and sexual reproduction. The infected animal excretes with its feces sporulated orchids into the environment. Transmission to a new host occurs via the fecal-oral route, either by direct contact with infected feces or indirectly by consuming water or food contaminated with orchis. After ingestion by the host, the orchis exist and invade the cells of the gastrointestinal tract where they undergo asexual and sexual reproduction, during which thin walled and thick-walled orchids are generated. The former generate sporozoids that autoinfect yet uninfected intestinal cells, while the latter are excreted into the environment with feces. Cryptosporidium parvum is considered the predominant species in cows up to 2 months of age. Cryptosporidium infection was found to be highly associated with an age of under 21 days. Somewhat decreased values were reported when lower numbers of animals and fewer farms were sampled. The findings are in agreement with research carried out in Spain, Mexico, and Canada, where a higher risk of Cryptosporidium parvum infection was reported in cows in the first 2 weeks of life compared to age groups from 16 to 60 days. The high prevalence of orchis excretion in cows under the 20 days of age strongly suggests that this is the most relevant age group to establish controls to prevent contamination of the environment with Cryptosporidium parvo, such as, for example, separation of infected cows from the herd. Cryptosporidium parvo is considered pathogenic, representing the principal causative agent of calf scores, characterized by diverse degrees of diarrhea, anorexia, and abdominal pain, and which may lead to death. Human infection with Cryptosporidium parvum subtype 2A is more common in developed countries, particularly in Europe than in developing countries. This may be due to the predominance of subtype 2A infection in intensive cattle production system in these countries, resulting in massive orchis contamination of the environment. People in contact with wastewater have a heightened risk of gastrointestinal infection. Surprisingly, relatively less attention has been directed toward comprehending the threat faced by farmers routinely exposed to wastewater, particularly in the urban and peri-urban irrigation hubs used for food production. The absence of well-structured on-farm practice and utilization of suitable irrigation techniques, coupled with the lack of on-farm wastewater treatment, elevates the annual risk of infection to a tolerable threshold. Domestic animals infected with Cryptosporidium can serve as reservoirs for transmitting the infection to susceptible individuals, including humans. People working closely with farmed animals, such as farmers and vets, are at an increased risk of contracting infection. Individuals who handle animals on calf farms, such as calf handlers, face an increased risk of contracting diarrhea due to the cryptosporidiosis transmitted from infected calves. Cattle are a substantial reservoir and source of zoonotic infection because Cryptosporidium parvum subtypes that infect humans have been found in cattle. This is the highlights the potential for the transmission of the Cryptosporidium from cattle to humans, posing a significant public health concern. Cryptosporidium parvum is an important zoonotic pathogen that can cause several outbreaks of diarrhea in industrialized countries, particularly in vulnerable populations such as immunocompromised individuals, children, and the elderly. Conventional, immunological, and molecular techniques are used in the diagnosis of cryptosporidiosis. Staining techniques in conventional microscopic methods are frequently used in the diagnosis of cryptosporidium agents because they are cheap and fast. However, its specificity and sensitivity may vary depending on the technique used and the expertise of the examiner. Molecular techniques, such as polymerase chain reaction, are very sensitive in diagnosing cryptosporidium agents, but they are not preferred in the routine patient screening because they are expensive and require more personnel. Molecular studies are mostly used in epidemiological studies. A cryptosporidium is an applicant intracellular protist and an important gastrointestinal protozoan parasite that affects a large number of animals and humans worldwide and causes important intestinal disease. The aim of this study was to investigate the prevalence of Cryptosporidium spp in cows in our region by microscopic and molecular methods. Material methods. The fecal material in this study was collected from a total of 150 cows up to 3 months of age, raised in different locations of our province, located in the eastern Anatolia region of Turkey. Fecal samples taken from the rectum of the cows were placed in individual sample containers and labeled. The samples brought to the laboratory were examined microscopically with quinone acid fast method for Cryptosporidium spp otis. Quinone acid fast methods, with the help of the loop, some pieces was taken and spread on the slide. The slides were left to dry. It was incubated in pure methanol for 1 minute. Slides were kept in quinone carbofixin for 5 minutes. It was kept in 50% ethanol for 3 or 5 seconds and washed with water. After soaking in 1% sulfuric acid for 2 minutes, it was washed with water. After 1 minute in Loeffler's methylene blue, it was washed in water. The slides were then left to dry. Then immersion oil was dripped onto the slides and cryptosporidium spp examined for August. After that, DNA extraction was performed from 150 samples using the Genematrix tool DNA purification kit according to the company protocol. The obtained DNAs were stored at minus degree 20 centigrade until the next steps. PCR amplification following the procedure previously described by Ixoye at Ixoye and friends. Small spined ribosomal rare RNA gene consists of 100, 1325 base pair fragment was amplified using an appropriate forward and reverse primers. Master mix protocol for PCR, 5 picomole appropriate primer for forward and reverse primer, and 200 micromolar DNTPs, 3 millimolar magnesium chlorure, 1 unit Taq polymerase, 10x reaction buffer, 2 microliter DNA was diluted to final volume of 25 microliter. DNA was dehydrated at 95 degrees centigrade for 15 minutes, followed by annealing at 55 degrees centigrade for 30 seconds, extension at 72 degrees centigrade for 1 minute for 35 cycles, followed by final extension for 7 minutes at 72 degrees centigrade. And after that, in the nested PCR stage, 5 picomole forward and reverse primer we used, and 200 micromolar DNTPs, 3 millimolar magnesium chloride, 1 unit Taq polymerase, 10x reaction buffer, 1 microliter DNA was diluted to final volume of 25 microliter. DNA was dehydrated at 95 degrees centigrade for 15 minutes because hot start Taq polymerase we used, followed by annealing at 55 degrees centigrade for 30 seconds. Extension 72 degrees centigrade for 1 minute for 35 cycles. Followed by final extension for 7 minutes at 72 degrees centigrade. And 1.5% agarose gel was then prepared and was stained using red safe nucleic acid staining solution instead of ethylium bromide. The PCR products were run through to agarose gel and images were obtained using a gel imaging device. Results. As a result of microscopic examination, cryptosporidium spp orchids were found in 24 of 150 samples. 16% we found. Cryptosporidium spp orchids, you can see in the picture, red balls, like red balls, small balls. As a result of nested PCR positivity was detected in 30 of 150 samples. 20% we found specific bands of 826 between the 826 and 664 base pair in size were obtained for cryptosporidium spp. You are seeing the nested PCR agarose imaging and marker negative control, P positive control. Some of the positive samples 9, 13, 29, 37, 53, and different results have been obtained in studies conducted to determine the prevalence of bovine cryptosporidiosis in different countries of the world. It has been reported to be at 25% in Mexico, 17.9% in France, 47.86% in Spain, 35.5% in USA, 27.3 and 40.6% in Canada, 70 and 25.4% in Argentina, 5.30 and 47.68% in China, 12% in Norway, 74.48% in Portugal, 37% in Belgium, 27.4% in Ireland, 28% in the United Kingdom, 9.5% in India, 27.2% in Pakistan, 30.2% in Egypt, 34.83% in Iraq, 36.6% in Iran, 27.1% in Malaysia, 16.3 and 39.65% in India, 13.8 and 15.8% in Ethiopia, 41.5% in France, 22.63% in Estonia, 4.4% in Korea. Studies conducted in Turkey reported the following prevalence: 21.88 and 65.8% in Ankara, 5.1 and 32.9% in Kars, 7 and 70.3% in Sivas, 22.14% in Hakkari, 8.13 and 13.18% in Van, 3.9 and 22.8% in Erzurum, 7.2% in Elazığ, 20.7% in Nevşehir, 40% in Kütahya, 34% in Kayseri, 37.2% in Burdur, 27.33 and 39.4%. The above-mentioned studies indicate a widespread Cryptosporidium spp infection, both in Turkey and worldwide. The zoonotic feature of Cryptosporidium spp increases the importance of these parasites in terms of public health. There are different methods for the detection of Cryptosporidium spp, including microscopic, immunological, and molecular techniques. The modifiazine-Nelson or Quignon staining technique is the gold standard. Molecular diagnostic methods, which are more specific and sensitive than classical methods, are widely used today for the specific diagnosis of cryptosporidiosis and the identification of species, subspecies, or strains. This study determined a prevalence of 16% and 20% using Quignon's acid-fast and nested PCR methods, respectively. The season, number of samples, number of animals with diarrhea, age of calves, care and feeding, conditions and methods used can be cited among the potential reasons for the differences between studies. Conclusion: as a result of this study, the prevalence of Cryptosporidium spp in cows in our region was determined by different methods. Molecular method was found to be more sensitive than the conventional method. More comprehensive studies should be carried out to determine the zoonotic enzymes, which are important for public health. Thank you. Be kind to your mind.